This morning, the worldwide coronavirus death toll has reached 1 million people. It happened in less than 9 months. More than 205,000 of those victims are Americans, and the rate of new infections in the U.S. is on the rise again. The Trump administration is launching a plan announced last month to increase COVID testing. The goal is to help schools and businesses reopen safely. Our lead national correspondent, David Begnaud, is in New York City, where elementary schools are reopening for in-person learning. David, this is going to affect a lot of kids.
And it's going to look dramatically different, Anthony. The people you see assembled behind me are getting ready to reopen this school. As you said, they're reopening in phases. Today, it's the elementary school. And we found out of the 1.1 million students in the New York City School District, which is the largest public school system in the country, about 52% opted to come back for in-person learning. So a pretty big number decided we wanted to stay home and keep learning virtually. Now, today's reopening of school just happens to come on the same day that the White House says we're rolling out millions more rapid tests, and here's why.
We're announcing our plan to distribute 150 million Abbott rapid point-of-care tests in the coming weeks.
That was President Trump on Monday, making good on a promise that he made a month ago. He is rolling out what appears to be a more robust national COVID testing strategy. In part, the White House says, to help get kids back to school safely.
1, 2, 3, 4, 5, into the test, and you wait 15 minutes.
The rollout is a sharp pivot for the president, who for months dismissed the need for increased COVID tests. The rapid testing comes as a new study shows an alarming increase for COVID cases in America's children. In the beginning of April, kids accounted for 2% of all the positive COVID test results. By September, that was over 10%. Dr. Yvonne Maldonado is a pediatric infectious disease specialist at Stanford University.
We've heard that all over the place, that children don't get infected, that they don't spread disease, and we know that's not true. So having said that, however, children are less likely to be infected with symptoms than adults.
The average rate of new coronavirus cases is on the rise in at least 26 states. In Utah, recent cases are rising. It's also where Alicia Geddes lives with her 16-year-old son, Turner. Turner runs track and cross country, but after recovering from coronavirus earlier this year, he has been sidelined due to chest pains and difficulty breathing. Specialists told both Alicia and Turner his problems are likely related to COVID.
The doctors said we don't know what's going to happen, and we don't know what the lasting side effects are. We need to be careful because none of us know how it's going to affect any of us.
Because the pains wouldn't stop, Alicia took Turner to see a heart doctor, a cardiologist, who examined his heart, put him through a battery of tests, and everything looked normal. You know, Gail, it's a story that doesn't get enough attention. These people who survive the virus, but then deal with lingering symptoms for months to come.
David, I keep hearing about these stories. You feel so great that you've gotten through it, but still there are things that you still cannot get past. I feel for Turner. What are the options?
Well, listen, the doctor said just keep doing what you do, but he said if you start to feel it as you start to run, you need to stop and let the body heal its way forward.
There's so much still unknown about COVID-19. Thank you very much, David. Good to see you.